Hello and welcome to Our Toxic Nation, a Call for Reformation Summit. I'm your host, Rachel Roshek, and I'm excited to announce our next guest and topic today with Dr. Mark Gordon. Our topic today is hormone replacement therapy and nutraceuticals for traumatic brain injury, an essential addition to the conventional care model. But first, I would like to introduce you to our audience. Dr. Mark Gordon is a world-leading interventional endocrinologist and traumatic brain injury treatment specialist. Through his work with veterans suffering from trauma, he has identified the connection between stress, brain chemistry imbalances, and the development of psychiatric disorders and cognitive decline. His groundbreaking research has been featured in 6 episodes of the Joe Rogan Experience. Dr. Gordon is internationally recognized for his contributions in the field and maintains collaborations with military organizations in Canada, New Zealand, United Kingdom, Ukraine, and Australia. Understanding the wealth of information needed to treat traumatic brain injury patients using the science of neuroendocrinology, endocrinology, neuropharmacology, Dr. Gordon invested 9 years writing a software application, the Millennium TBI Office Laboratory Assistant, an expert AI software program designed to interpret the Millennium's 28-point biomarker panel, present medication, and past medical history. This allows for any healthcare provider to duplicate Dr. Gordon's work and results in 15 minutes as opposed to years of training and clinical experience. Welcome. So I'd like to ask you a few questions.
Sure.
In my experience, the lack of adequate hormone replacement therapy in our current healthcare model, it's leaving a lot of people unnecessarily disabled. How are hormones important to brain health and traumatic brain injury healing?
That's a great question. And I think the starting point is that our perception of what hormones are, we think of them as gender hormones or sex hormones or reproductive hormones, but all our hormones, testosterone, estrogen, progesterone, pregnenolone, allopregnenolone, all the hormones are what we call pleiotropic. What pleiotropic means is that they have a multitude of benefits. It's not just sexuality, libido, and so forth. For instance, looking at estradiol, when you look at studies on cognitive impairment and dementia in women as they go from perimenopausal to menopausal, the reason is because estradiol plays such a significant role as a protective hormone against things like Alzheimer's disease, Parkinson's disease. It helps drop inflammation in the brain, which really should be the starting point that inflammation is the key causation for a lot of the cognitive and emotional problems that we see, as well as degenerative diseases like multiple sclerosis, Parkinson's disease, Alzheimer's, CTE, the chronic traumatic encephalopathy, and ALS. These are all inflammatory processes. Turns out that hormones like estrogen and testosterone help to regulate the inflammation. So if you have inadequate amount of hormones as we age, and you've had a car accident or a slip and fall or an assault, or the military that I take care of who have had exposure to IEDs, improvised explosive devices, or repetitive gunfire, or mortar shell, or a tank, or slip and fall, that inflammation is precipitated. And this inflammation, if there's no hormone, it just runs wild. It's like a fire and no water to put the fire out. The testosterone functions like that. Estradiol, pregnenolone, progesterone, allopregnanolone, and cortisol, all these hormones. So when we do an assessment of an individual, it's not just about looking at testosterone, estrogen, progesterone in a woman and looking at testosterone in a male, but it's looking at the entire cascade of hormones, from cholesterol to pregnenolone to DHEA to allopregnanolone to testosterone to dihydrotestosterone to estrone, estriol, and estradiol. Looking at all the hormones because they all have an integral part to play, like cogs in a wristwatch, very expensive watch, Philip Patek, those cogs are very expensive and very important. And in our brain, each hormone is extremely important in how we function in the brain. Repair of the brain, cholesterol to pregnenolone to progesterone to allopregnanolone, has been found to help protect the brain from chemistry that leads to depression, anxiety, postpartum depression. And a pharmaceutical drug was developed maybe 8-9 years ago called Zulrosso, brexanolone, which is just another name for a hormone produced in our brain, in our own brains, called allopregnanolone. It's $34,000. We can get it for $80 a year using things like pregnenolone. Okay. So, yeah. So that is why a lot of people who have hormone testing are not getting adequate hormone testing. They're getting just a very minuscule glimpse at what it is. Think of how we see images these days. We've got 4K, we've got 8K, we've got 2K, we've got 180 pixels. If you have very few pixels representing each one of the hormones we test, if you have very few of them, how can we see clearly the picture of the health of your brain? We can't. So what we need to do is have an adequate amount of these hormone testings, the pixels, to give us a better understanding of what is going on in the brain. Now, it took me 14 years to develop a 28-point biomarker panel, which is at the core of our assessment, and it generates enough data points to give us a level of treatment that exceeds the traditional hormone replacement therapy offices and the testosterone replacement therapy offices that don't do, number one, adequate amount of testing, especially if you walk in there and says, I've had a car accident, or I had a motorcycle accident, or I was blown up 3 times in Afghanistan. And they'll do the very minimal amount of testing thinking they're got you covered. They don't. They've got themselves covered.
That is very true.
Okay, testosterone's low, let's throw you on testosterone. And then you turn to him and says, well, when you give me testosterone or estradiol, that's going to turn off a hormone produced in the brain called gonadotropic releasing hormone, which is the master hormone that tells the pituitary to make luteinizing hormone that turns on estrogen production in the thecal cells of a woman, turns on testosterone production in the Leydig cells of a man, and it turns on follicle stimulating hormone, which helps females develop their ova and the males develop their sperm. But when you give testosterone by itself, or estradiol by itself, or estradiol and testosterone in a woman, you shut off the trigger, the rate limiting factor, luteinizing hormone, that turns on 35 brain hormones called neurosteroids. And without those neurosteroids, you will lead to depression, anxiety, edginess, agitation, sleep-related issues. And this is all in the literature. It's not what I'm making up. It's all in the literature, and there's some beautiful articles out there, and that's what I do. I read the science, the beautiful science that's already been done, but it's sitting on someone's back burner because it's not part of the narrative for today. It's not part of the narrative of how to do the very best.
No, it surely,
Yeah.
it really doesn't seem to be. And, I read your paper, A Path Less Traveled, How Alternative Medicine Became Mainstream. And I noticed that there were a lot of alternative treatments that have been quasi accepted into the conventional model, but hormone replacement therapy is still not included for some reason.
Well, testosterone is not considered in the majority of traditional medicine as an alternative treatment. It is a hormone replacement under endocrinology. But understanding in the area that I work in called neuroendocrinology, understanding how the hormones directly interact with our nervous system, and it doesn't interact with the nervous system only, it involved with our immune system. So what happens when you have any kind of inflammatory process like a vaccine, Lyme's disease, mononucleosis, Epstein-Barr virus syndrome, cytomegalovirus, meningitis, viral or bacterial meningitis, certain medication that goes into the brain, or chemotherapy or radiation exposure that goes and starts a process of inflammation in the brain and wipes out your ability to make hormones. There was a group of articles that started appearing in 2013 that showed that if you have inflammation in the brain for whatever cause, from whatever cause, that it shuts down the ability of the hypothalamus, which is the regulatory for the pituitary, stops it from producing that gonadotropic releasing hormone that tells the pituitary to make testosterone, estrogen, pregnenolone, all our hormones, and turn on our gametes, our sperm and our ova. So inflammation in and of itself can lead to sterility and hormone deficiency. And one of the battles that I've had in the past 15, 20 years, out of the 30 years I've been doing this, out of 43 years practicing medicine, is that everybody believes that in order for you to have hormone dysregulation, you need to have trauma to the pituitary. You need to have damage to the pituitary, but that's not the case. You can have damage to the hypothalamus, or you can have inflammation that dysregulates the communication between the hypothalamus and the pituitary. And that's what I'm seeing in all the cases of our military. And the misperception is that you need to be knocked unconscious to have a traumatic brain injury be meaningful. Not so. Not so. We have two groupings, if you will. One is called subconcussive, or out there they like to call it repetitive head injury. Well, subconcussive is where you have a ding, a minor impact, a minor event, which doesn't create any immediate symptoms, overt immediate symptoms. And that's subconcussive, as opposed to the concussive, where you have a concussion and you immediately have problems, nausea, vomiting, blurred vision, double vision. You might be in a coma, or you might have disorientation or cognitive impairment. You might have memory loss, proactive memory from the incident forward for a short period of time, or retrospective amnesia from now back. So you don't remember how you were knocked unconscious. Okay.
Wow.
So the difference between the two is with the concussive, with all the initial symptoms, is that starts the process immediately. You stated in an earlier conversation we had that within a day of your trauma, you started to have changes in your personality, cognition.
It was I was knocked unconscious. I hydroplaned into a guardrail going 60. So upon impact, I was knocked unconscious. The moment I woke up, I had symptoms. The way that I was responding to things when I was taken in the ambulance, I'm afraid of needles. So when they tried to give me an IV, I flipped out. I literally felt like they were trying to kill me instead of just being slightly uncomfortable. And that lingered for many, 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 many years.
Yeah. Yeah, we've had a couple of people who have had a traumatic brain impact injury without loss of consciousness, knocked to the ground. The next day he wakes up, totally different person.
Oh yeah, yeah, completely
Totally.
different, stranger.
Yeah.
Yep. Mm-hmm.
It took us about 3 months to get him back on track, and
But
it
see,
was
you're getting
widespread.
them back on track. That's to me, being misdiagnosed with head injuries, going through the conventional system, hearing you speak, and because of hearing you and Andrew Marr speak, that's how I learned I had traumatic brain injury, because they missed the diagnosis. Then going through the functional system, it's tough. I truly believe, as a TBI survivor, that your work needs to be rolled in with the conventional care model, or they at least need to be aware of it because it's
Right.
so impactful.
Right. It's an uphill battle because the medical establishment already has their concrete, preconceived modalities for
Yeah.
treating people with traumatic brain injury or subconcussive. I disagree with a lot of what they're doing because it doesn't address the causation, cause and effect. You have a traumatic brain injury, you develop depression, so the effect is, I'm going to give you an antidepressant. Instead of saying, wait a second, because of the traumatic brain injury that you have, you generated inflammation. You generated also free radicals. Those free radicals caused your cells, the immune cells in the brain called microglia, to start dumping inflammatory chemistry called cytokines into the brain that are interrupting chemical pathways, chemical processes. So you're now dysfunctioning biochemically, neurochemically dysfunctioning, and that's why you develop things like depression. We know as a fact that when you have a head trauma or anything that creates inflammation in the brain, you generate a chemical called peroxynitrite. And the peroxynitrite actually damages enzyme systems that lead to the production of serotonin. No serotonin, depression. Leads to enzyme deficiency or effect on producing melatonin. So you can't make melatonin, so you're insomniac, you can't sleep.
Yep.
And then by not being able to make melatonin, serotonin, an amino acid called L-tryptophan backs up and gets converted into something called kynureninic acid, which causes MDD, which is major depressive disorder, according to the research that's been done by Dr. Takamura in Tokyo, Japan. And it's really clear in the science that he presents and the volume of science that's out there. So you can develop from inflammation, depression, anxiety. You developed panic. Panic is because of inflammation from the lateral aspect of the limbic system, the emotional center, the amygdala. And when the amygdala is inflamed, you lose some chemistry, as well as when you lose the hormones. It turns out that testosterone and dihydrotestosterone help the amygdala to stop you from being panicky, startle response, anxiety, inflammation, influences those areas, so you're hyperreactive. And then the influence on the sympathetic nervous system, parasympathetic and sympathetic in the hypothalamus, which is the hypothalamus that regulates our hormones in the pituitary, also regulates what? Heart variability, blood pressure, temperature, body sweating, heart rate, and respiratory rate is really what I meant to say. So we've had people who are on multitude of blood pressure medications, 3 blood pressure medications, a guy we finished with just recently. And over the course of 6 months, he starts dropping his blood pressure medication. His blood pressure is normal.
That's amazing. I take blood pressure meds. Yeah.
Because your hypothalamus. Look up the hypothalamic function, and it's dysautonomia. Okay? POTS syndrome. Okay, so we see people with POTS. I have a video on the YouTube channel on dysautonomia that I explain the process and how we've been able to reverse the problems. Not all of them, but a good amount of them is through correcting the inflammation, neuroinflammation.
That's amazing. And neuroinflammation is really something, even for me, 19 years in, trying to find answers, I'm just now learning that it's a factor into this stuff. It's not being handled. It's not being addressed. It is disabling. It absolutely is disabling.
Yeah, it absolutely is. You know, my history back in the 90s, I had, up until the time that I developed depression that needed medication for it, I had 6 head traumas and not a single one with loss of consciousness. One was close. Okay, when I was 13 and hit by a car riding my bicycle. Okay.
Oh, wow.
That was the closest one of possibility of having had a loss of consciousness. But throughout the years, martial arts, you know, fighting 3 people at once, and earthquake-related trauma to my brain, to my head. And while I was taking this one medication, which wasn't really working for me, 6 months in, wasn't working for me, I read an article about hormones and influencing brain function. So I had my blood tested, and I was deficient in growth hormone, IGF-1, thyroid, and testosterone. And got on treatment. 90 days later, starting to be a totally different person. Now it's been 30 years that I've been on hormone treatment. I'm not on it every single day anymore, because when you correct the underlying problem, if you have a fire burning in the house, a small fire, like a kitchen fire, if you let it go, it goes to the living room, the dining room, it goes to the breakfast room, it goes to the bedroom 1 and 2, it goes to the bathrooms, burns the house down. Okay. But if you have the fire and you catch it early, you can stop the fire and make repairs. And once you make repairs, you're done. And what we found, and you made the comment, years later, we had a gal, Mona from Arkansas, who came to us 30 years after her injury, 30, 48, yeah,
Wow.
30 years after her injury, 32 years after her injury from Arkansas. And we treated her and she started getting off all her medication. I remember she told me she went to the psychiatrist in Arkansas who had prescribed the medicine for her. And she says, I'd like to get off the medication, the antidepressants. And the psychiatrist said, a female psychiatrist said, honey, I put people on antidepressants. I don't take them off. So I sent her to another doctor who specializes in detoxing off medication. I don't take any of the patients who come to me off their medication. I refer them back to the primary
Right.
for medical legal reasons, as well as it's a means of educating the doctor that, hey, there is something other than your pills. So
Yes.
once you fix it, it's like, so the house burns down. So you get the insurance money and you pay and have the house rebuilt. Done. You don't have to keep on rebuilding the house. The same thing if we do it correctly the first time in correcting the biochemistry of the brain. And sometimes we do need to leave them on medication like testosterone or estrogen, perimenopausal, menopause. You know, guys go through menopause, women go through menopause, which should be woman pause, right? So anyway, terminology, crazy. Anyway, so we didn't just, but it was last year we had a 56-year-old Army major who was on our program for 6 months. He was on 8 medications and not doing well. At the end of 6 months, he's off of 8 medications and he stops our protocol. He keeps on going, and I talk to him periodically. In fact, this weekend I got to call him. So we see a lot of people. We've had over 10,000 people go through our program.
And it is a shame. I mean, as a TBI survivor myself, I'm on a lot of support groups, online, things like that. People don't get better.
No.
They do not.
Yeah.
And the hard part about it, from my perspective, is I've known a lot of people, self-lived with it, and you don't know what you're missing. Like, that's the problem.
Right.
Most of the people think they're healed because they've gone through the conventional system, they've done the therapy, whatever, but there's still so much more.
Yeah.
There really is.
Yeah. It's like the analogy I make is an automotive one where the car stops and you take it to the store, to the shop, and they go and they put water in the radiator, they put more transmission fluid in, they put more brake fluid in, they lube up all the tires in the ground, and they try to start the car and it doesn't start. And they say, you need therapy, the car needs therapy. The only thing they need to do is put the gasoline into the vehicle, okay?
Correct. Yeah.
And that's the only thing that's missing. And what happens in us is that with the trauma, we lose the fuel that runs our brain that keeps everything level. Go to Google Scholar, go to Google and just look up neuropsychiatric conditions, hypogonadal with low testosterone, estrogen, and you'll see all this stuff. You look up neurodegenerative diseases and low hormones, and you'll get Parkinson's, you'll get Alzheimer's, you get dementia, you get age-related cognitive impairment or cognitive impairment of aging. And it turns out, I just gave a lecture on the Alzheimer's disease and understanding a hormonal approach to treatment. And it turns out that all our hormones help to correct the process that leads down a pathway, the journey in our brain to create the chemistry, the beta amyloid, the tau proteins. It's all inflammatory precipitated. And now they're starting to talk about, a lot of the people with Alzheimer's have a history of traumatic brain injury, multiple sclerosis. We just reversed our 6th case of multiple sclerosis. In the literature, 30% of the people who develop multiple sclerosis have had a concussive head trauma. Now, the Navy lieutenant that we finished with, and his story, he tells his story on our YouTube channel, and he's now been in remission for 14 months. 100% remission, no medication.
That's amazing.
No pharmaceutical drugs specifically for multiple sclerosis, because it's an inflammatory condition. For him, he had two loss of consciousness, 16 and 18, I think it was, or 13 and 18. But
Hmm.
he had a history of traumatic brain injury with concussive loss of consciousness, and that set him up. And the literature talks about it. So I'm not making anything up or trying to pull strings together. This is in the literature. It's in the scientific literature.
Now, why do you think, after everything that you've said, and just from what I've lived through personally, the impact that proper hormone replacement therapy has on your health, why do you think that this isn't being recognized by conventional medicine?
There's still a stigmata for testosterone, growth hormone, estradiol. The Women's Health Initiative in 2001, made women afraid of estradiol, but they should only be afraid of the estradiol that's synthetic, artificial estradiol that they use, the ethinyl ethanonates or whatever. But we have 100% bioidentical, bioequivalent, bioidentical estrogen, progesterone, testosterone, which is safe. So in those that say, well, if you use testosterone, it's going to cause prostate cancer, it's not the case. And the point is, if growth hormone, they say growth hormone will cause cancer, which I give a lecture showing that it doesn't. It actually protects you from cancer. So I said that if it was true that growth hormone predisposes you to cancer, then all of us should have cancer.
Yes, that would
We
be
all
accurate.
have growth hormone, right? And then
Correct.
looking at the people with gigantism, which is due to superfluous production of growth hormone, they have a less occurrence of cancers than the general population.
Huh.
Okay. It's a project I did in 2007. It's a DVD on my website. I'm giving it away. Okay. It's $1. So anybody can get it. It's called Growth Hormone Testosterone Cancer Mythology. Okay. And it talks about estradiol, which has a higher relationship with cancer. Okay. And guys getting prostate cancer seems to be more because of estrogen being higher than our testosterone. It's called
That's
testosterone
interesting.
index on the prostate.
Yeah.
Yeah. Yeah, I've had some training by some really top people in the world of hormone replacement and urology and uro-oncology, cancer and your genital system. So the reason why is because they're still working on the mythology that hormone replacement causes cancer. When I did a project over 10 years in China, women were very afraid of getting hormones. They wanted to be on, the natural stuff, the soybean and genistein and diastine and all that good stuff, red clover, black cohosh, and all that. Wonderful. But it's because they were afraid of getting on the real hormones, because they
Mhm.
were instilled with the perception that it's going to cause cancer. Same thing in projects in, Canada and Spain, other countries that we work in. It's just the perception, because doctors are promoting wrong information,
Hmm.
misinformation. Why
So
are they doing it? So they don't have to. I personally feel they're doing it because they don't want to have to deal with it, because it means they'd have to learn.
I was just about to ask that very question, is where in the education process is something like neuroendocrinology taught?
You can go and get a fellowship in neuroendocrinology. You do your endocrinology, you get your neuroendocrinology. I'll be perfectly honest with you. I self-taught myself endocrinology. And by the volume of information that I've read and, the writing that I
Yeah.
do, which reflects how much I've learned on it. And I've got endocrinologists who tell me I know more about endocrinology, neuroendocrinology than they do, than neuroendocrinology.
Yeah.
And I give an 8-hour course on what this area entails. I still read. I don't call myself a neuroendocrinologist. I say I work in the field of neuroendocrinology so that I don't portray myself inappropriately. But the information, it doesn't matter what title you give yourself. My goal is to achieve a level of understanding in an area that is being missed, because
Yes.
now the military, I work with the military, interact with a lot. They're starting to look at the neuroendocrine disruption.
Good.
Okay. They're starting to
Good.
look at it. May, I was invited to 3-hour meeting where I shared my thoughts on how the military should possibly integrate a TBI protocol, our TBI protocol into it, and how they should treat it. And I've been doing this since 2017 with the Navy SEALs, with the Airborne, with Fort Bragg, the Green Berets, and so forth and so on. I'm not doing anything because it's the wrong people that I'm talking to. No, it was great to talk with them. They're not the wrong people. They were the right people to seed with the information and make aware that there is something alternative to, or I shouldn't say alternative. There's an option. I don't want to call it alternative, like alternative medicine. There's an option for treatment that works better. All our people get off their drugs.
I think that might have something to do with it. And in my experience, the alternative medicine is what saved my life. It definitely wasn't conventional medicine.
There's a role for conventional medicine. I don't badmouth it. I never badmouth it because there's a role that it plays. And that's why I think that there should be a melding of the two, as well as a parallel study. Let's take a group of 100 veterans, put them on the traditional assessment and treatment protocol, and then let the Millennium protocol jump in, do the Hormone 28-point biomarker panel, which is processed by a computer software package, an AI software program that gives us diagnoses, suggestions, recommendations, and then predictive treatment.
That's amazing.
That is what we put people on. Release that I did May when I went to lecture for Green Beret in Florida. It was results of our 2019 to 2021 project. There were 840 participants, not quite 50-50 military civilians. I think there was 300. There was more civilian than military, but nonetheless, they ended up with a 78.3%. The 78.3% of that group were 50 to 100% better in 12 months.
That's outstanding.
And that's what every year I have a summary report on our website, tbihelpnow.org, under the science section, where you can see the results of our studies, our outcomes. I don't like to call them studies. People come to us, we put them on program, they fill out every month a questionnaire, and from that questionnaire, we see their improvement. So people come in, they're at 0. They've got all these things wrong, 25 things wrong. And you see, as they're month by month by month, they get better, better, better. And then we run their laboratory, and you see the initial labs, how bad they are. There's a score called a NEACE score, which looks at neuroendocrine evaluative score, where it looks at the 28 markers and statistically analyzes them and gives a number. And then the next time they have it done, it reevaluates it. So they might be poor and, a number of 10 out of 100. And then they come back, they're at 60 out of 100 because the hormones have improved by our treatment of them, or supplementation, DHE supplementation, or pregnenolone, or testosterone.
That's amazing.
So we have very good results. And then about 3 years ago, one of our civilian doctors came to us and was talking about his ringing in the ears called tinnitus. And he said, "What can I do?" So I put him on 2 of our products, and he said, "Call me in 2 weeks." 2 weeks, he calls back. His morning ringing in the ears tinnitus is gone. At night, he doesn't need his white noise machine. And he said that, and I said, "Really?" And I went back to our population. The first person I went back to is my military partner, who is Andrew Marr, one who he and his brother wrote the book, Tales from the Blast Factory, that became the documentary movie that was up for 2 Academy Awards, called Quiet Explosions. It talks about, not me, it talks about cases. The people are telling their cases, military, gymnasts, football players, surfers, cardiac heart attack patient, talks about their benefits on our protocol. So in the movie, it clearly enumerates all this. But anyway, I went to Andrew and I said, I told him about the doc, Spencer. And I said, how's your tinnitus doing? He said, it's all gone. I said, why didn't you tell me? He said, why didn't you ask me? And that was a bump. And we were just getting ready to walk in to do our third podcast together with Rogan and in 2021. And he said that his tinnitus disappeared 18 months earlier. So what happened was I went to all our military and civilians and started sending them out a request for how their tinnitus is. And we have 129 people in the study. It's ongoing. And they fill out a paper every month, which is for their entire well-being. And there's a question now that says, how is your tinnitus doing? And they mark it 90% better, 40% better, 30%. So we're at the tinnitus is 57.3 or 53.7. My dyslexia kicks in every now and then, but they're doing extremely well. And it's on their program, on their standard program. This is a side effect. And we've also had reversal of 29 cases of type 2 insulin resistant diabetes.
That's amazing. Yeah.
Wasn't going after.
Wow.
I had to get re-educated in what we did that created that. So
let me ask you this. What is the correlation between traumatic brain injury, hormones, and our current psychiatric care model?
As I said, the influence of inflammation on biochemical processes, the production, manufacturing of neurotransmitters, serotonin, melatonin, epinephrine, norepinephrine, dopamine, all these hormones are influenced negatively when you, negatively when you have inflammation, because peroxynitrite is one, we've got hydroxyl groups, we've got reactive oxygen species, we've got reactive nitrogen species, which are inflammatory chemicals or radicals that turn on inflammation in our body, in our brain, in our body. I mean, knee pain that you have is due to these cytokines, these inflammatory interleukins or cytokines. And they create the chemistry, the prostaglandins, the arachidonic acids, the omega-9s. It makes all these chemicals that stimulate pain. We have to feel pain in order for us to understand that there's a problem. If we didn't have the processes of making pain, you'd never know that you were shot or you had a nail in your foot or you cut yourself on the fence you crawled through, So our body has these symptoms or these systems in play. And it turns out that in February this year, Andrew and I ended up in Maryland at AMSIS, which is the American Society of Federal Hospital Workers. I was invited through Georgetown University to give for us to give a presentation on neuropathic pain. Neuropathic pain is what happens in the brain when you have pain, cut your finger and pay no mind to it. Okay, but how about if someone just taps your hand and you freak out and you're pain and all that? That's because in the brain, this peroxynitrite amplifies the signal coming from that little tap. And instead of it being a 1, it doesn't do anything. It gets amplified in the brain to a 6, a 8, a 10. So what you're feeling is amplified through this thing called peroxynitrite, which also increases the risk for Parkinson's disease. So if you look at the statistics on the military, a veteran who has not had any traumatic brain injury has a 1 to 3% chance of developing Parkinson's disease. But if you're a veteran who has had a traumatic brain injury, you're 56 to 83%, 56 to 83%, 56 to 83% risk of developing Parkinson's disease. And it's not too far off for civilians who have had a car accident. Okay?
Yeah, I know what you're talking about, honestly. You just answered some personal questions.
So the question is, you've got this like me, I had 6 head traumas, no loss of consciousness. You had loss of consciousness. I might have had loss of consciousness at 12 years of age, which is very significant. As you get
Yeah.
older, you've got longer time of the chemical processes happening, but the inflammation needs to be addressed. That's the key. And that's why, we developed over 16 years clinically in my clinical practice, we developed a grouping of products which were tested. And I just released September, I think it was, a study that we did in 2020 in Camp Pendleton in California, Camp Pendleton, where the Marines are.
Mhm.
So I gave a presentation. I was called and asked to give a presentation for the commander and the surgeon and 16 officers in a private session, and they liked what I presented, and they ended up sending me Marines who were in the process of getting medically discharged because they were messed up. So what happened was, put them onto one product in the morning, and they filled out a questionnaire every 30 days for 3 months. And in that group, 65% of them were 50 to 100% better. At the
That's
end
amazing.
of 90 days, 35% were less than 50%. They could have been 49% better. Okay. But for us, we have a very high bar because in testing out these products, we've tested out every single one of our products with military. Okay. From Navy SEALs to medics in Fort Campbell, Kentucky, to the Marine First Recon Group in Pendleton. And what became important to understand was, why did 35% not achieve 50% or better? That was the real important question to answer. And it turned out drugs, alcohol is the worst when you
Oh,
have
yeah.
traumatic brain injury. It continues the inflammation because it creates inflammation. It damages your ability to make hormones in the brain, growth hormone being the most sensitive one. And not eating correctly, not hydrating, no exercise, no meditation, no relaxation, and also gut-related problems, which is extremely important. I have 3 daughters, 2 are docs. The one that works with me, Doc Allison, Doc Allie, is a naturopath, and her focus is on gut, brain, and gut. And she's worked with me for 10 years, and over 10 years, she's developed her expertise in the area that I work in, called neuroendocrinology. She's probably the best read and functional application of neuroendocrinology in the naturopathic world, and possibly in general medicine too. And she came to me and said, look, we've got to start looking at gut-related issues. And it's because of the cytokines and everything that I knew about, but she brought a testing to me, a gut testing protocol, and we're now using it, and we're finding a lot of the civilian and military that we take care of who do not excel at improving. Something else is going on. We look at
Oh,
their
absolutely.
lifestyle, and then we look at their gut. So I send them over to Allison. She runs their gut, and she finds stuff. And when she fixes it, they get better.
Imagine that.
Oh my God. The car has the flat tire and I'm driving, boom, 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 boom. I stop and fix the hole in the tire and fill it up, and you're back in life driving level. That's what it's about.
Yeah, gut issues, the gut brain connection is very real. I'm a TBI survivor myself, and I have had some major GI issues after becoming exposed to toxic mold. And I can tell you that the interplay is at times very difficult to, as the person that's going through it, kind of pull them apart to see which is which, what is causing what. They seem to be so intertwined that it's difficult for me to wrap my head around why they aren't treated together.
Yeah, it's all compounds the same pathway. Okay, it's like you had a slip and fall and you got a head trauma. You had a car accident, you had a head trauma. You had a bicycle accident, you had a head trauma. So you've got multiple avenues of generating the inflammation. Okay, so yes, if it's active, if it's black mold, nigrans, black mold, you want to get abatement of it or move to another place that doesn't
Yes.
have it, right?
Oh, yeah.
That's why you want to get away from it. If it's something like Lyme's disease, Epstein-Barr virus, what you want to do is put it under wraps, get it taken care of. One of the things that I found in our cases of Lyme's disease is that I've got a guy that probably had it for 30, 40 years, and they never tested it until we started working with him. He's in New York, and he was found to have, all the markers for it. He didn't have active disease, and that's the issue. You have to define if it's active disease or it's post active disease syndrome from the inflammation it left over. The same thing we're seeing in meningitis, COVID, bacterial viral meningitis. We're seeing that the residual inflammation, if you don't take care of it, you continue with symptoms, even though the Lyme's is gone, the COVID's gone, what is it? Meningococcus is gone, or the Epstein-Barr virus or cytomegalovirus or whatever virus that caused the meningitis or encephalitis. We have one guy with equine encephalitis, which is Japanese equine encephalitis. He developed it when he was in Japan, lost his vision, was in a horrible mental state. We assessed him, treated him. Still is blind, legally blind, but he's living a quality life because we
That's
stopped
amazing.
the inflammation,
Hopefully, as we move forward, that'll be recognized as more of a driver than it is right now. It's kind of unfortunate. The conventional medicine.
We need more voices.
That is very true. That is very true. I also have Lyme disease. So that is a whole nother topic, the whole Lyme disease dilemma. It's unfortunate that it is not recognized the way that it needs to be.
Mhm.
And the residual effects, like you said, the inflammation, it's a huge driver.
Yeah, it's the infectious traumatic brain injury. We have two classifications. We have a traumatic brain injury and we have non-traumatic brain injury. We have a physical traumatic brain injury and non-physical traumatic brain injury. Breaking your leg can cause a non-traumatic brain injury.
Really?
Yeah. Having an ulcer can cause a non-traumatic brain injury. Having Helicobacter pylori, a bacteria in the gut, can cause a form of non-physical, non-traumatic brain trauma. Why? Because in every single one of those scenarios, those case issues, you have the cytokines, the immune system, releasing cytokines, interleukin-6, interleukin-1 beta, interleukin-1, tumor necrosis factor alpha, that goes right into the brain and turns on the inflammatory system of the brain. So if you look at studies that have been done on something like psoriatic arthritis, it's an autoimmune disease, psoriatic arthritis, rheumatoid arthritis, Crohn's disease, it's an autoimmune gut-related issue, that they all have depression in something like 60 to 90% of the cases. When they get treated with the anti-inflammatory or the cytokine blocking chemical like Enbrel or whatever else is out there, not only does their psoriatic arthritis disappear, but the depression that went along with it disappears. So if you look at, there's an article, it was a cute article called Cytokines Play the Blues. Okay? Inflammation chemistry creates the blues, referring to feeling blue, depression. And we know as a fact that it causes depression. And the mechanism is the inflammation creates peroxynitrite that damages the ability of the brain enzymes to make serotonin, to make melatonin. If you don't have melatonin, don't sleep. You get sleep deprivation syndrome, which is associated with cognitive impairment, emotional volatility, mood swings, mood issues. And it's all in the literature. You just have to open up the literature and digest it and then say, whoa, maybe that's the real reason why this person has depression. It's not the fact that their father yelled at them or their mother didn't suckle them right, or that their sister didn't share her pickup sticks with her, or or something of that nature. Which brings us, as hilarious as that might not be, or might be assumed, I'm not trying to be humorous about this, this is very serious stuff, is that I was approached by someone in the psych field who takes care of PTSD. And I told this individual, great person, she still talks to me every now and then, that I didn't believe in her main thesis on PTSD, post-traumatic stress disorder. Because in the true world, if you've had a trauma, that PTSD is really a reflection of the traumatic brain injury.
That is,
And when people
that's
ask me, how
big.
come I don't believe in PTSD, is because I believe that PTSD is the untreated TBI.
Interesting. I also have that all, it's like I'm hearing this information now. It's amazing because it's a strange feeling that your life is suddenly being explained through, papers and
Yeah.
doctors, and yeah, it all fits.
So what
Absolutely.
happens is, what you can go and read the paper I did in last year for the Department of Health and Human Services, which was a comparison between TBI and PTSD in our population. So I sent out a random invitation. I sent out an invitation of 250 invitations for our military to come into the program, to this study, to this data review. And of the 250, they were given 72 hours to respond. So it became random. So 79 people responded. And I looked at those who had, by the Veterans Administration, a pure diagnosis of TBI, and those who had diagnosis of PTSD. I looked at their monthly program questionnaires. Every month they fill out this questionnaire, 25 points, answering physiological, physical, and psychological functioning, how they've improved. So I looked at the PTSD ones, went back to their medical records, and every single one of them had a traumatic brain injury.
I believe it.
Okay. So why wasn't that put into the VA's report as being an influential aspect to their developing down the road PTSD? My belief is that the longer you have untreated TBI, the more biochemical changes happen in the brain, more chronic inflammation leading to chronic loss or dysfunction of neurotransmitter production, neuroreceptors. So you can make the transmitter, but you have no functional receptors. Or you can't make the neurotransmitter because you've damaged the enzyme system, the L-tryptophan hydroxylase, the L-tryptophan decarboxylase. You've damaged the important enzymes that convert one chemical to a functional chemical, or one amino acid or peptide to functional peptides or amino acids. They don't look at that. They don't look at that. Okay.
And when you don't look at that, then the treatment options you have for PTSD are just abysmal. It really.
Yeah. What are they? They talk about, hypervigilance. They talk about insomnia. They talk about panic attacks. I see this in all of our people, from TBI to, all forms of TBI. So we put the people through the process, and the paper talks about it. And they had a 73% of them were 50 to 100% better in a year. Whether or not they had it compared the outcome with those with pure TBI and the outcome with those with PTSD who also had TBI, that wasn't it was documented in their records, but it wasn't included as a causative factor. And then there's this crazy article out there, absolutely crazy, that said the following. It was a group of psychiatrists. They said that, in looking at veterans, they said that even though every one of these veterans had a traumatic brain injury. We believe that regardless of having had the TBI, they would have developed depression anyway. Yeah. So that was a scratching head kind of article.
Yeah.
Yeah, there has to be a cause and effect. The only thing is they don't look for the cause and effect.
Correct.
They just randomly start treating you. 2016 or 17, I did a very short presentation for an organization called RadFest, which is called In Search of the Prozac Gland. And the premise of it was that we have a gland that might be Prozac gland, the Abilify gland, or whatever, and that at certain points in our life, we develop a deficiency of these chemicals, and therefore we need to have it replaced. But it really talked about my life experience with my depression from 6 traumatic brain injuries, my partner who's on 13 medications, full-blown alcoholic, suicidal, and off all his medication within 90 days. He ends up getting an MBA, writes a book with his brother Adam, ends up founding the Warrior Angel Foundation, and puts on these programs for fellow veterans. And he and I work together in making awareness of what we're doing available to as many people as we possibly can. We go to military bases, we're involved with military organizations, but you know what? It's still not enough.
No,
There's so much resistance, as you know.
Just on the patient's end. I heard you speak. Hearing you and Andrew Marr on Joe Rogan is how I even figured out that I had a head injury.
Right.
And then going through the conventional system, trying to find even a little bit of hormone replacement therapy, endocrinologists, I got laughed at when I came in and I said, I think I have hormone imbalances. They would laugh at me and send me away.
Right.
It's abysmal, and it's not right that people have to live like that.
I agree with you. And all it takes is them to read a couple of articles, just one of the articles that I would send to them, which basically looked at people with traumatic brain injury and hormones. They found that in 3 months after having a traumatic brain injury, that 56% of the individuals had one or multiple hormone deficiencies. Testosterone, growth hormone. Growth hormone's number one. Thyroid, cortisol. I mean, in the pecking order of what most commonly happens. Growth hormone first, thyroid, testosterone, estradiol second, thyroid third, and cortisol last. So in 3 months, 90 days, 56% of the people with traumatic brain injury have one or multiple hormone deficiencies. When you go to a year, so the acute phase is 3 months. When you go to a year, the chronic phase, 36% of those people who had traumatic brain injury still have one or multiple hormone deficiencies. And that is the group that continues on to develop deeper and deeper personality issues, cognitive impairment, emotional turpitude.
Yes. I know for me, I was misdiagnosed as bipolar 2 with a handful of other conditions. I was over medicated to the point that I was not myself. I couldn't hold down a job. I couldn't have a regular schedule of any sort. It was it was awful. It was
Yeah. So when you got onto hormone replacement therapy, HRT, what was the time frame for improvement, and what were the improvements that you perceived?
Well, I was given testosterone, estrogen, and progesterone. My head injury was in 2006, and I started. So 12 years after accident is when I started.
12 years after?
Yeah.
Wow.
I was misdiagnosed. The hospital missed the head injuries altogether. So I was 24 years old, bad car accident, hospital missed putting traumatic brain injury on it. Then when I start complaining about emotional dysregulation and psychiatric issues, I was immediately put into psych, where once you get a label like bipolar 2, you are no longer listened to, and they just keep shoving drugs down your throat. It was 8 years of that. I left, I quit, I took myself off all the meds, was able to rejoin the workforce, moved into a place with toxic mold, and that's right around when I heard your podcast, which was what got me onto hormone replacement therapy. Yeah.
Okay, well, great. So this is what we see in both our civilian population and our military. My daughter Allison takes care of all the civilians, professional sports, law enforcement, fire department. I take care of strictly the special forces and regular Army military, helping them to regain what they've lost in the protection of our country.
It's amazing. Yeah.
So I'm self-funded. We generate funds from a multitude of things that we develop and do to help to pay for our veterans coming into the program. We don't pay 100%. We pay about 60%, and they have a little skin in it. Trying to get the government, the Department of Defense, to look closer at what we're doing. I mean, we've been recognized by Walter Reed and Georgetown University in having a program that works. Okay. And that's how I ended up getting lecturing for them last year. And you can see the presentation I did, which is called Neuroinflammation, the Road to Neuropsychiatric Illnesses, which basically says that the inflammation creates the change in chemistry, dysfunction of chemistry in the brain that makes it obvious that you're going to develop, depression, anxiety, bipolar, obsessive compulsive, all these things. Okay. And we know that it works because we've got all those medical diagnoses. We've trained 23, 24 psychiatrists. We've got 2 major facilities that are independent from us. One in Florida with Dr. DeMaio, Meisel DeMaio, who came to us 4 years ago who was frustrated by the fact that traditional medicine wasn't helping her patients. She's in Florida, I said. And she gets into our program, gets trained, starts using our software, and she's having miraculous recovery in patients. She calls me frequently, which I love, sends me documents of the cases. One case of a 26-year-old, I think she was 26, who had a car accident, who developed panic attack, personality, and paranoid schizophrenia.
Oh, wow.
Paranoid schizophrenia. And her doctor was getting ready to put her into the state psych facility. And the naturopathic doctor said, send her over to Dr. DeMaio. Sent her to Dr. DeMaio. 3 months later, she's almost off all her medications. 6 months, the mom's happy. The kids come back. Okay.
Oh, that's
And
lovely.
she never went in. And we have a Dr. Jason Kiefer, a psychiatrist in Hawaii. He's got a multitude of clinics. He takes care of the military, he takes care of private people, civilians and so forth. He's doing phenomenally well, taking these people who would have been on medication and feeling the negative effects of the medication, along with their, underlying biochemical dysfunction, and not done well. Not done well, but he's turning them around. So we've got, I just was in Utah, and a couple of the doctors came to get refresher class for me. And on my website, the educational website, TBI Help Now, you can go to the TBI team and go look. You'll see all the psychiatrists labeled there, where they're located.
That's great. I'm so glad to hear that you're working with psychiatrists, because I can guarantee you that there are more people who've had, subconcussive head impacts or even traumatic brain injury going in, just like I did, with all these symptoms, and you get given a bunch of drugs, and that's the end of it.
Yeah.
So I really thank you for the work you do. You have a new product coming out called NeuroShield, correct?
Correct. NeuroShield it took me 3 years to go through the research to see which of the medicinal, not psychedelic, but the medicinal, like shaga, reishi, the cordyceps and so forth, which ones worked well together to do one thing: drop the inflammation in the brain. So we ended up with 6. And there's a video on it, and there's a paper that got released and picked up by, I think it was psychedelic spotlight, with these medicinal mushrooms. And it'll be out in the end of the year. or in January, first quarter. And they are all synergistically working to drop inflammation to encourage recovery and repair of neurons. So if you look at each one of the mushrooms that are there, turkey tail and, so forth, turkey tail and, reishi, misha, cordyceps. There are 6. Most of the products that I develop have a limit of 6 components, and that's to avoid confusion. So that it's not, these added things, these micro things, it's the core issue. And then all our products are nanoliposomal, and nanoliposomal ensures that they get absorbed. The worst thing to do is take something and you can't absorb it. If you've got dysbiosis or problems with the gut, you might not be able to absorb it, but because of it being nanoliposomal, it passes through healthy tissue. If it's inflamed gut, it's not going to go through, like so many things won't pass through it. So the benefit of the mushroom is being tested out now. We do a special inflammatory marker test for our veterans who are in our study group. And then we put them onto the NeuroShield. And then we come back 3 months or 2 months and we check their inflammatory markers. And if the markers go down, we know the product's working, because we won't release any products that haven't gone through testing. I mean, before we released the Brain Rescue 3 product, that was the study in 2020 with the Marines. Before we released the Clear Mind and Energy, that was 2017 with the SEALs at Virginia Beach. And then before we released the Brain Care 2, which is our key anti-inflammatory component, we did the study in Fort Campbell, Kentucky with medics who would know, medics, they would know that they're getting better. And they were all blast related injuries. Blast wave produces traumatic brain injury through what they call overpressure. Pounds per square inch, rattles and shakes it. Anything with air-filled cavities get damaged. So we see a lot of people getting better. So NeuroShield will be out.
That's great. We're going to include a couple handouts on that for our viewers. And if people want to contact you, where can they reach out?
The best place is they can go to the TBI Help Now, and there are 2 spots where you can click it and fill out a little form, click it and send it, as well as probably the most definitive is a website called TBImedlegal.com. TBImedlegal.com. That is just to ask to be enrollment, to get an enrollment application for our program. It's got prices, it's got alternative pathways, it has our phase 2 protocol, which was what was developed from our study with the Marines out of Camp Pendleton. It's an inexpensive, no blood work done. We've got over 7,000 people that are on it. And it's phase 2 protocol, no doctors.
I love it.
It walks you through it. It's what we're going to send you. We're going to send you and get you on the phase 2 protocol so you can experience the improvements. Okay. And, that's basically it. There's a lot of information on our website. So we try to digest a lot of the science and present it to you so that it's easier for you to absorb. So read is basically it. Okay, until we get, we've been thinking of adding to our Shopify store the ability to acquire a console, a short console, 30-minute console. We're looking at that possibly for next year, because we've had people who email us and ask questions. Because of the patient load that we have, we have to be very careful about our time utilization so we can get through the work. I'm 2 weeks behind as is, because my daughter, who takes care of the civilians, just had a baby. So she's on maternity leave. So
congratulations.
So of the 3 daughters, my middle daughter, who works with me, had her daughter, Mia. So I'm a little bit overloaded. So a lot of things that I'd like to do, I can't do because there's no time. So I start my mornings at 5 a.m. and I finish at midnight.
Oh, wow.
And I
Well,
work 7 days a week. And I'm not complaining. I love what I do because seeing the effect, the outcome on people is really what makes this, a work of passion and,
and
passion.
you know it intimately too. I mean, you can actually put yourself in those people's shoes, which is not
Yeah.
always, not everyone has that kind of perspective. So that's
Yeah, I
amazing.
call it visceral knowledge, meaning that once
Yes.
you had it, it's like for years I would have, I had originally a family practice. My original training was family practice. Then it added endocrinology, orthopedics for 14 years, and so forth and so on. And I had people coming to me with earaches.
Mhm.
And they would ask for narcotics. I'm not good into narcotics. In fact, I limited my own drug prescribing, so I can't prescribe narcotics because I don't want people coming to me asking for it, especially during the time that there was that big oxycodone thing and so forth. It was horrible. And in fact, I'll tell you, narcotics increase pain in the body.
Yes, they do.
Yeah. And
Yes, they do.
in one of my lectures, I show the mechanism. It's called the toll-like 4 receptor is what it causes it. So you're on a psychological getting your pain reduced, but on a physiological level, the chemistry is being fostered
Yes.
for inflammation.
Yes.
Toll-like 4, yeah.
I was in pain management for 5 years because I learned to walk properly again.
Yeah.
Never again.
Yeah. So also naloxone, low dose, yeah, creates the problem. All the different forms of opioids create the problem. They're additive. So if you want any of the papers, I'll send them to you. But
Yes.
anyway, so the way that most of our patients come to us are from podcasts like with yours or from other vehicles, avenues that we've had. Montel Williams, Outside the Line, some of the CBS, NBC, ESPN projects that I've done. My goal is to get out there to as many platforms as I can because what's holding people from getting better is knowledge,
That is correct. And also
awareness.
systemic change needs
Yeah,
to happen.
that we have an alternative that, traditional medicine is just about passing pills.
Correct. Yes.
As opposed to fixing the underlying problem, just keeping
And
everything status quo.
correct. And there's chronic illness. I feel like it's everywhere now, but it's not being treated like you said, where we figure out the whys, or if it's environmental, it's even harder.
Right. And there are a lot of environmentals. There are things called endocrine disrupting chemicals. So
Yes.
you've got the Roundups, you've got the PSDs, the ABCs. I just go through any letter and it's out there. Which altered the ability of our immune system to function. Now we're seeing a lot of sterility and hypogonadal people from the spike protein because the spike protein creates from COVID, the spike protein creates a chronic inflammatory process. As I said earlier, chronic inflammation in the brain stops your ability to make follicle stimulating hormone, fertility, testosterone, estrogen, libido, physical functioning, sense of well-being. I mean, testosterone is responsible for a sense of well-being, assertiveness, competitiveness, cognition, memory, recall, the ability to learn new things, anti-depression, good sleep, good sex, also creativity, visual creativity, auditory creativity, written creativity. I've had people from Hollywood that were, Academy Award winning writers, screenwriters, and they lost it. Musicians, I won't tell you the groups that we've seen, but musicians who have had lost their ability, painters, opera singers, who had found that they just weren't able to do it as they were. And you look at their hormones, you look at their inflammation, you look at their history. The history led to the hormonal deficiency in the majority of cases.
Yeah, I'm a fine artist, and I can tell you that my creativity, it completely stopped. My work just became very create what I saw in front of me. There was no real kind of creativity behind anything,
Yeah.
just working on
Mm,
technique, but even that's really difficult.
yeah.
So, yeah,
Understood.
it's absolutely true.
So we see the improvement. I mean, I play a better, worse guitar, when my hormones are great. It's better off of a shot of scotch, but stay away from that because the alcohol in the brain. So
Yes.
yeah, when the literature started coming out, I revamped my entire nutrition. Went from maybe having a scotch before dinner 3-4 times a week to maybe once or twice a month.
Mm. Yeah, I
So
could definitely, if I happen to drink now, I could feel it. I'm not
yeah,
interested.
yeah,
No.
it affects the brain to the point where I don't like waking up not feeling perfect.
Yes, exactly. It's not
Perfect.
worth it the next day.
Yeah, it's not worth it.
No.
So, I take my vitamins, my supplements, I take things to protect the brain, the quercetin, the zinc and selenium and multivitamins, good quality multivitamins. So, and that's basically it.
All right.
Okay.
Well, I want to thank you so much for taking the time to speak with me today. It
Absolutely.
was an honor to meet you, and big fan of your work.
Thank you. Appreciate it. Now we got to get the word out there so more people can enjoy quality of life.
Absolutely. There's no need for people to unnecessarily be basically disabled or miss out on just the vibrancy of day-to-day existence that we're supposed to enjoy.
I agree. I agree.
All right.
Thank you.
Thank you very much.